Hello, today I'd like to talk with you about the effects of teratogens on prenatal development. Fortunately, prenatal development goes relatively smoothly and normally for most babies and their mothers, but sometimes things do go wrong during prenatal development due to the effects of teratogens. About 15% of newborns have minor problems associated with teratogens, and around 5% have more significant problems due to the effects of teratogens. As you probably already know from your reading, there are three different types of teratogens. Can you think of what those three types of teratogens are? They are drugs, diseases, especially viruses, and environmental hazards. In looking at the effects of teratogens on the unborn child, factors that we need to take into consideration include critical periods when different organ systems and body parts are the most vulnerable to the effects of teratogens. And of course, this is when those parts of the body are developing the most rapidly, or what's called organogenesis, the genesis or origin of organ systems in the body. Also, the dosage of teratogen and the duration of exposure are factors that influence their effects. And the genetic makeup of the child, because sometimes some children may be more susceptible to teratogens than others due to their genetic makeup. Also, the environment of both the mother and of the developing baby prenatally are important as well. For example, if the mother is receiving good nourishment, or she passes that on to her baby, and that is a factor, as well as other environmental influences that can either magnify the effects of teratogens or maybe help protect the developing fetus from at least some of the effects of those teratogens. One area where the effects of teratogens is very dramatic is in the use of the drug thalidomide, which fortunately is not used all that much anymore, and not for its originally intended purpose of treating morning sickness. But when we look at how thalidomide affected the developing fetus and the kind of birth defects that it caused, it points out rather dramatically how the specific effects of a teratogen can vary based on when the teratogen is introduced into the prenatal environment. So about 50 to 60 years ago, thalidomide was used by a lot of pregnant women who were suffering from morning sickness, and everybody thought it was safe, but sadly, it caused some rather significant birth defects. Thousands of women who used thalidomide during the first 2 months of pregnancy gave birth to babies with all or parts of their limbs missing, with the feet or hands attached directly to the torso like flippers, or with deformed eyes, ears, noses, and hearts. The specific body parts that were affected depended on when the teratogen was introduced into the prenatal environment. If the mother had taken thalidomide 20 to 22 days after conception, which would be 34 to 36 days after the first day of a woman's last menstrual period, her baby was likely to be born without ears. If she had taken it 22 to 27 days after conception, the baby often had missing or small thumbs. And if thalidomide was taken 27 and 33 days after conception, the child was likely to have stunted legs or no legs. And if the mother waited until 35 or 36 days after conception before using thalidomide, her baby was not usually affected at all. This information on thalidomide that I'm sharing with you today comes from a textbook called Lifespan Development, written by Seigelman and Ryder. Another dramatic effect of a teratogen on prenatal development is the Zika virus, Zika, a more recent troubling virus that causes babies to be born with abnormally small heads and microcephaly, severe mental retardation. As you may be well aware, it's transmitted by mosquitoes. There are many other teratogens really that can affect prenatal development. One other one I wanted to mention is alcohol. When mothers drink during pregnancy, it can adversely affect the developing fetus and result in fetal alcohol syndrome. You'll have a chance to learn about fetal alcohol syndrome in your reading. But one of the things that happens with babies with fetal alcohol syndrome is that they have certain distinctive facial features. They tend to have abnormally small heads, lowered intelligence, various kinds of cognitive deficits, and sometimes other behavioral problems associated with the fetal alcohol syndrome. Nobody has really established what's a safe amount to drink. This idea about whether you can drink or not during pregnancy does have some controversy associated with it, but it seems to many that the most reasonable approach to take would be to not drink at all and to not take any risk that the baby might be adversely affected by drinking during pregnancy. So this is a little bit of information to consider on teratogens, and it really helps us to appreciate the delicacy of the prenatal environment and how the effects that teratogens can have on developing fetus depend a lot on when they are introduced into the prenatal environment and which organ systems are most rapidly developing at that time. Thank you. I look forward to talking with you again soon.